Hi guy, hello, welcome back to my YouTube video channel again. This video is to show you how you can use Septocaine with bend needle technique, that you can go in and patient have very little sensitivity or pain as you go in. So check this out.
So when I do that, the tendency, the volume of the liquid fluids go inside slower, and so the patient don't react with a lot of pain. So I just did that, and did you feel a lot of pain?
Yeah.
Right, the trick is bending the needle. That's the trick. I'm using Septocaine, and also the way I angle. If I go like this to begin with, it's painful. So I have to aim sideways like this. Okay? And this way started, I walk slowly up, and then back down on this one. So don't go with the needle all the way, and just go slowly a little bit, and go and just a little bit infiltration slowly, but don't put the needle all the way in. That's painful. Yeah.